lost within the depth of your own mind, questioning who you are and what you are. Hatred for every cell that has made up on your body, defining you to be someone that you know you are not. Sadness. Sad that knowing happiness can be so close, yet coming out could mean you lose everything. Lost, hatred, sadness, this cycle of vicious emotions course through their minds daily, hourly, or even every minute. As they through these days, each day under such a false pretense, just to try to come to the terms to who they are. Who are these people? The media calls them transgenders. For activists, T is the label in the LGBT. As a medical professional, we have a very sophisticated term called gender dysphoria. But to me, they are just people, humans, like you and I. And I don't think a lot of people realize this. I'm not intended to patronize anything, but just because I used to be like them. As a practicing psychiatrist, no doubt that we have heard about gender dysphoria, but through books, texts, and research. It is part of our so-called DSM-5 menu, a very thick, huge books with all these funny checklists. You will be headache after reading all this. And they are simply telling how a psychiatrist to do their jobs. But what I couldn't imagine was that this disorder can be so real and it could be so normal. I thought people with this disorder, initially weird groups, even a social deviants, perhaps, looking for a new way to express their gender in their society. But since 2008, when I first met my first transsexual patient, she has totally changed my mind. It has been a very impressive journey for me to dance with these patients all along throughout these 10 years, and making me realize how this mental disorder, so-called, can be so real in her situation. My first impression was that, wow, she was, for lack of better words, a normal guy. She was a normal guy, okay? She had a job, family, dreams, aspiration, as we do. The list of how she was like everyone goes on and on, because she is no different from us. My second thought, this disorder was real, so real, it wasn't just a call for attention. She has undergone 14 surgeries in the past 14 years. Every year, she visited the operation theater looking for a better surgery outcome. For what reason? For a more ideal self. One hindsight in my mind is that upon meeting this patient, I finally realized the legitimacy of these issues. Like depression, as a psychiatrist, we of course would offer much of our help to these patients. However, because of her dedication, her commitment, and her just being like us, inspired me to further delve into this previously extremely neglected area to help people facing similar issues. In fact, you ask me, what actually are they facing? What issues they have so far? I can mainly categorize them in three main levels. First one, individual. Second, immediate social circle. Third one, the society as a whole. The individual, of course, they suffer from gender dysphoria, which means they are suffering from considerable mental distress because they often identify with a sex that differs from the pre-assigned birth gender. Imagine, everyone, please imagine. I'm sure most of you can emphasize by looking at the mirror and seeing you, yourself in it, disliking a part of a body. Now imagine all these emotions. Multiply by 100. Screaming at you every time you speak, every time when you try to put your jacket on your chest, every time you try to relieve yourself in your bathroom. No scratch that. Imagine all these self-hatreds have been streaking at you 24 hours a day, 7 days in a week. Just simply because we humans have proprioception. We know that we have a sense of our body parts where such sense has been distorted, that she thought she has a chest but it isn't there, or she shouldn't have a sexual organ but it is there. This hammering sense of self-hatred and constant self-doubt all arises from this single truth, that they were born in a wrong body. The immediate social circle, their family, their school, their workplaces. Many of these individuals know that when they come out and seek relevant changes in their life to become their preferred gender, but even though there has been increased the awareness in the public recently, and there is still discourse for this small population, patients with gender dysphorias are frequently neglected, marginalized, or even ignored. Coming out is never an easy process. It even becomes a very dangerous part in their life. Why I say so? In terms of family, they often struggle for acceptance and often face the imminent threat of being disowned. In workplaces, they were being discriminated frequently or being treated unfairly, or even after coming out, they will soon be laid off soon afterwards. In their schools, especially male transitioning to female students, bullying, harassing are commonly encountered. They are usually the victims. For a person already undergoes such a mental and or psychological distress, with lack of support from these social groups around them, definitely is the detrimental processes to their mental health. And so, therefore, with no choice, they chose to continue closeted, unhealthily repressing all these emotions in the losing battle against their daily silent struggle. What about our society? The transgender population remains a very small population in Hong Kong or worldwide. They are frequently stigmatized. For people in the process of transitioning, of course, they are stared at in the public. They will be avoided as if they are contagious, and they will be treated differently. They often become the victims of sexual harassment or even rape. It is as if they are some way a subhuman, not to deserve any respect that you and I should have. But don't forget, they are not any different from you and I. Gender dysphoria is not a depression, not anxiety, not schizophrenia, not bipolar disorder. It is more common in common with a bone fracture than any other mental illness. Because while yes, the root in the issue was just a psychological disorder, and it is the only psychological disorder can fully and completely recover by surgery. I repeat, this is the only psychological condition that can be recovered completely, fully by surgery. I've talked about why it is an important issue. I've talked about what the situation is at the current situation. Now, I will talk about how we can solve the issues. As a medical doctors, we are more than defaulted to solve problems in these three ways: biological, psychological, and social. And let me tell you what we can learn from each one. Psychological, that's what I'm used to do it, day in and day out. I provide psychological support to them by diagnosing them with the condition and giving them a name that legitimizes their complex feeling. Unlike other diagnoses, for example, cancer, it does not mean any horror, shock, or denial, but actually to them it's a relief. It shows that they are not alone. There are often persons in the community having her same situation as they are, however small, but at least they are understood and are going through what they are experiencing. Relief to be able to be finally verbalize how they feel during the session, and relief that can often entail the fact that we can go on forwards with physical changes that can make them feel more comfortable in their own skin. The first thing we need to learn is that they are human beings. And human beings, it is normal to seek social acceptance, giving an identity and community to label themselves, and as supporting them is the first step in liberating them from the dismal depths of loneliness and despair. Secondly, of course, biological. Just like you would get a surgery when you suffer from a bone fracture, this group of people feel dysphoric because of their body was not all right. So what we can do is to help them to change it. How to change it? There are hormone therapy, giving them a facial or body changes according to their gender that they identified with, so as to help and alleviate their dysphoria. There are even voice or speech therapy, or further, top or bottom surgery, depending on each individual needs. The second thing I want to bring up is that how every person in an individual being and each person's journey is different. There are no fixed template. Male transitioning to females often request the removal of the penis as they see it as an identifier of their own gender. It is disgusting to them. However, for female transitioning to male, some of them may decline the construction of a penis because to them, in essence, it is not competent and functional. So it is only considered in somebody who would like to have one only. Just like we are all individual and different, when it comes to its community, there is no one size fits all. Every person has varying levels to which different parts of their body causes them dysphoria, and thus seeking different models of medical procedures to help them feel much more comfortable. Finally, the social aspect. Although psychiatrists are doing the social part, but a wider social context also helps to define how the individual views themselves. Human is actually an intrinsic social animal. What they need are peer and family acceptance. They need support throughout their journey of realizing themselves. Although the past 10 years, there is much less social stigma in our society and has been much more discussion on this issue. As long as this group of individuals that require so much help continues to be marginalized, we need to have a change in the society. I told you that I was able to help them, not because of my degrees, my experiences, but because I understood them. I understood that they were just like every one of us. In their challenges, their confusion, their differences, I saw the similarities. And I was able to understand what they need. They need to be welcomed by every one of us. They need to be seen as an ordinary person. They need not to be seen as someone with a disorder, but a brave individual in the journey of finding, realizing, actualizing who they are. Transgenders, transsexuals, patients with gender dysphoria, whatever you wish to call them, they are just simply names, labels, for a group of people in the midst of a very special journey in their lives. Ultimately, we need to welcome their differences because ultimately they are just people like you and I. Thank you.